Hi everyone. Today I'm going to be covering the stage of toddlers. This stage of development is very important, although it only spans a short period of time in a person's life. This is the time of many developmental milestones, and most famously, the terrible twos. Personally, I think this stage of development is one of the most interesting because of the numerous changes a toddler is going through. There are many developmental milestones during this stage that are fascinating to witness. And in my personal experience, watching my nephew go through the toddler stage was one of my favorites. He was adorable. Communicating with a toddler can be frustrating, but they're cute, so it doesn't count. And hopefully you can learn a few things about my presentation that you didn't already know. And without further ado, let's get started. So here's a brief overview of the toddler stage. The toddler stage is from 12 to 36 months or 1 to 3 years old. Many new cognitive developments are occurring during this stage. Toddlers begin to learn new expressive and receptive language skills. Children learn to receive and process communication before they can express it themselves. At age 1, toddlers begin to give short and simple responses. By the time a toddler is 2 years old, they know over 100 words and can respond to more complex commands. By age 3, a toddler should be using short sentences that can be understood by other people. At this age, toddlers also have a newfound autonomy, which means they do not need a parent or guardian to be in their direct line of sight to know they will return. A toddler can also begin to solve problems such as moving objects out of the way to find a toy and can remember the solution for the next time. An important development in toddlers is their moral recognition. They learn to share and can differentiate between an accident and an intentional act. We will be discussing later on in the presentation Erikson's stages of development along with Kohlberg's theory of moral development. These theories are an explanation as to why toddlers behave the way they do. They provide an insight about a toddler's reasoning and problem-solving skills along with their moral development. As for physical development, growth rates begin to slow down as they shed their baby fat and their posture begins to straighten. By the age of 2, it is safe to say that a toddler is 50% done growing in height. At age 2, a toddler may appear to have a pot belly as the lumbar spine is curved. By age 3, the spine begins to straighten along with their posture. They also begin to gain more balance and will eventually be able to run and climb stairs. As they gain more mobility, toddlers begin to play independently or alongside another toddler. There is an increased risk of accidental injury during this age as their curiosity can get the better of them. I will discuss later on in this presentation in regards to medication overdose in toddlers. Finally, the toddler stage is when potty training occurs. Toddlers gain bladder and bowel control during this stage. Erikson's autonomy versus doubt and shame. During Erikson's second stage of psychosocial development, a toddler may face many new challenges. During the previous stage of development, trust versus mistrust, an infant begins to trust adult figures to meet all of their emotional and physical needs. Now, during the second stage, a toddler must learn to make decisions on their own without 100% dependence on an adult. This newfound responsibility can cause doubt and shame if something does not go their way. Frustration caused by a not-so-ideal outcome may cause a temper tantrum. A parent's role in this stage is to allow for independence, but with supervision and safety in mind. Toddlers will get into things they're not supposed to, but it is crucial to their development. At this age, toddlers have egocentrism, which is the inability to see things from another person's point of view. This idea by Piaget highlights a toddler's misconception that everyone has the same reasoning that they do. It is hard for them to put themselves in another person's shoes and understand their feelings. Therefore, a toddler may not be able to understand why they are being punished because they truly believe that they are right. It is hard to navigate big feelings in such a small body. It is nothing to get angry about, and patience and guidance is needed during this time especially. Kohlberg's pre-conventional stage of development. The three stages of Kohlberg's theory of moral development are pre-conventional, conventional, and post-conventional. During this first stage of moral development, toddlers obey the rules they are given to avoid punishments from adults. Toddlers accept the rules given to them as concrete. For example, in a toddler's mind, I should not hit my sister because mom said so and I don't want to get put in timeout. The toddler has not yet developed the moral sense that they should not hit their sibling because it will hurt their feelings, but rather because they fear the consequences. In addition, a toddler has a strong yearn for reward. They follow rules given to them because they want something in return, not because it is the right thing to do. A parent's role during this stage is very important. A child's moral reasoning is highly influenced by the environment around them. These environmental factors include family values, religion, and cultural practices. Although a toddler does not have full comprehension of these traditions and values, they are highly impressionable. It is common for parents to only recognize poor behavior, but it is equally or even more important to recognize good behavior. Positive reinforcement and reward is important for a toddler to associate good behavior with a good outcome. As proposed by B.F. Skinner, there are different types of discipline, all resulting in different outcomes. Positive reinforcement is when a child receives a reward for doing something good. On the other hand, negative reinforcement is taking away a stimulus to get a desired result. An example of this is taking away a toddler's toys in order to promote good behavior. Positive reinforcement is effective for toddlers because it will increase the chance of a child repeating the positive behavior in return for a reward. Health promotion, vaccinations. Healthy People 2030 discusses the goal to reduce the amount of fully unvaccinated children of 2 years or younger. The target goal was to reduce the number to 1.3%. As of 2015, the desired goal of 1.3% was met. This number is low, but there is always room for improvement. Vaccination is crucial to the health of the toddler and the people that come in contact with them. Vaccinations have prevented the spread of deadly diseases that affected the world in the past. In 2019, there was an outbreak of measles in unvaccinated children in the United States and Canada. This outbreak was most directly linked to the lack of MMR vaccinations in children. In this study, parents were asked to explain the reasoning behind not vaccinating their children against MMR. The main reasons were distrust of medical practitioners, wanting the vaccine to be given by a primary provider, concern for autism and bowel issues as side effects, and not wanting to follow up with a second dose. It is important for a toddler to be fully vaccinated by the age of 2 in order to conserve herd immunity and prevent future outbreaks. Health promotion, autism spectrum disorder. Healthy People 2030 wants to increase the amount of special services that children 4 and under with ASD receive. The target goal is 53.3%, and in 2016 through 2017, the outcome was 43.3%. In order to receive special services before the age of 4, it is important to recognize indicators of ASD early on. Some of these indicators are challenges in communication, such as failing to respond to names and simple commands, challenges in social interactions, repetitive behaviors, and fixations on special interests. These symptoms must not be caused by developmental issues, and they must be inhibiting everyday function. The severity of these symptoms are assessed and classified into levels 1, 2, and 3. It is important to not self-diagnose, but gain the opinion of a medical provider as well. The criteria for the evaluation of ASD is constantly being researched to better understand it. State intervention programs under the Individuals with Disabilities Education Act are helping these children receive special services. Toddlers that participated in these programs seem to have improvements in social emotional skills, knowledge skills, communication skills, and behavioral skills. Along with that, parents of these children learned how to properly support their toddler with ADHD. Health prevention, medication overdoses. Healthy People 2030 discusses the issue of emergency room visits due to medication overdose in children under 5. In 2016 through 2017, for every 10,000 emergency room visits in patients under 5, 25.6 were attributed to medication overdose. The target goal is to reduce this number to 16.6 out of every 10,000 emergency room visits. This is a risk for toddlers because of their exploratory nature. They are not familiar with the consequences of taking over-the-counter or prescription medication. These instances are most likely to occur in the kitchen, bathroom, bedroom, or at a relative's house. The goal of the Poison Prevention Packaging Act is to improve safe packaging of prescription drugs and to educate about proper dosages of medications and safe storage mechanisms. One example of this instance occurred in 2018 when a 22-month-old girl ingested a small amount of compounding cream that contained clonidine. This caused an immediate reaction of unusual mental state along with unstable vital signs. This resulted in intubation and ventilation. Luckily, she was able to become stable after a night in the hospital. Another example of this instance occurred in 2021 when a 2-year-old boy was found with an empty bottle of primaquine pills he ingested. Initially, he was asymptomatic until 2 days later he developed lethargia, a high fever, hypertension, and increased heart rate. Luckily, after medical attention, he was able to make a full recovery. It is important to raise awareness to parents and teach them about safe storing skills. These instances are almost never intentional, but they are preventable. And although these 2 cases had happy endings, that is not always the case. It is crucial to the safety of a toddler to keep all prescription drugs safely hidden away. Health prevention, abuse, and neglect. Out of all of the spans of life, toddlers are the most susceptible to abuse. A sad but true statistic is that more than 1,700 children die annually in the United States due to child abuse. The interesting thing about abuse in toddlers is that these patterns of abuse can be generational. If a parent was abused as a child, this may reflect in their parenting skills. A study was done that observes the link between the history of childhood abuse in mothers and the way that they interact with their child. The study showed that mothers with a history of abuse showed less interest and enthusiasm in their child. But there are ways to try and prevent toddler abuse. A nurse's role is to look out for warning signs of abuse when evaluating a child. Abuse can be prevented directly after birth by following up with a postpartum questionnaire for the parents about their general feelings. There are also crisis hotlines for parents if they feel overwhelmed by the responsibility of parenting. If there is a suspicion of abuse, surveillance and follow-up care should be addressed by a medical professional. There are some warning signs of abuse in toddlers as well, such as injuries in unusual places that are unlikely to be caused by a toddler, a lack of empathy or even blame on the toddler from a parent when injury is present. A big warning sign is a lack of medical intervention or partially healed wounds on a toddler. Finally, overall bad hygiene of a toddler could be a warning sign. Although these signs are not 100% indicators of abuse, it's better to be safe than sorry. So that's all I have. Thank you for listening.